identify the respective substances in the clearance graph. So this graph is actually this graph is clearance graph. So as you can see, here is the Bowman's capsule, this is the proximal tubule, and here is the distal tubule, and this is the last part, which is urine. Okay, and here question is asking identify the respective substances in the clearance graph. Substances here is A, B, C, and D. So we have to identify that. Okay, so for that let's draw a diagram, and then we'll discuss for that. So suppose this is the women's space. So this is, and this is the efferent and efferent arteriole. Okay, so suppose this is the efferent and this is the efferent arteriole. So blood is flowing from here. So blood is flowing from here, and if blood is flowing, so something will filter. Obviously something will filter. So whatever the substance, a smaller substance, and you can say freely filterable substance, a substance can filter, they will reach at this space. Is it? Cells cannot filter, protein cannot filter, and cells like RBC, WBC cannot filter, but other thing can filter like glucose, amino acid, and inulin, pH, then so many things, bicarbonate, and so many things can filter easily. So here is the women's space substance, and after filtration, what will happen to that substance, and till the urine, formation of urine. So there's different part. Suppose this is women's space, this one, and this is the proximal tubule, distal tubule, and this is the last part, or this is the urine, you can say directly. This is the urine formation. So in between, is there any change in the concentration of the substance or not? So first, C graph C. This is a straight line. Can you see this line is very straight? It means there is no change. Something, it makes us, we can say that something is filtered here, and the substance neither reabsorbed here, neither reabsorbed or not secreted. So substance, whatever substance is filtered, that same substance reach at this level. So that substance is clearly, we know, the inulin, neither reabsorbed not secreted. So no change in the substance. So this graph is for inulin. You can easily say that this substance is inulin because there is no change, because whatever filtered here, they will reach to the urine without any change. Okay, the second graph will discuss about the D. What is D? Something reached to the women's space at this level and is increasing. Concentration is increasing actually. So what may be the substance? It means substance filtered here, and after that something is added here from outside. Is it? Something is added more. So this is a secreted, some substance is secreted. So that is this D graph is actually a PAH graph, para amino hippuric acid. The next graph I will discuss about the A graph. So this is the A graph. Can you see clearly A graph? So this is the proximal tubule, and before that substance is filtered here, and after filtration the concentration is decreasing rapidly, and it is reach up to zero, almost zero in the proximal tubule. So what may be the substance? It means the substance is completely reabsorbed in proximal tubule only. So that is actually glucose. Glucose is completely reabsorbed in the proximal tubule only. So nothing left in for urine, nothing you will get in the urine if concentration is low. If concentration is very much high, in that case you may get some in case of urine. So after 180 or 200 milligram per deciliter, so that is a different case, but here its condition is normal. So 100 milligram per deciliter, suppose this is 100 milligram per deciliter. So in that condition there will be no you will not see any amount of glucose in urine. So in that case all the glucose will be reabsorbed. So that A is actually glucose. Okay. So now what is V? So B is actually bicarbonate. Bicarbonate, because bicarbonate is around 70 to 80, around 80% is reabsorbed in the proximal tubule and left around 20% which is excreted in urine. So that B graph is actually bicarbonate. Okay, so clear. So here identify the respective substances in the clearance graph. So we can clearly see inulin, there is no change. Whatever secreted, whatever filtered here, excreted in urine, that is the inulin. D graph, whatever filtered, the more than that is actually excreted in urine, means some more amount is excreted. So that is actually para-amino hepatic acid. Then A graph is showing all, almost all 100% is reabsorbed, nothing left in urine. So that is actually glucose. And B graph is actually around 80% is reabsorbed and some amount is going to excrete in urine. So that is actually bicarbonate. So here we can say here A is inulin, no, A is not inulin, A is glucose. B option, B is A is para-amino hepatic acid, no, para-amino hepatic acid is actually D. C is A is glucose, B is bicarbonate, okay, C is pH, no, this is all wrong. C is actually inulin, so this is not wrong, and this is also a wrong answer. So D, A is glucose, B is bicarbonate, C is inulin, and D is para-amino. So this is going to be our answer. Clear? So let's move to the next question. So here the question is ventricular action potential sequence order. So first thing is opening of voltage gated sodium channel. Yes. So action potential. Suppose this is A, this is B, this is C, and this is D. Okay. So what happens here? Here, discuss the graph. Sodium will go inside. So this is suppose resting membrane potential RMP or minus 90 millivolt. Okay. So from minus 90 millivolt, so here is suppose threshold potential, and that after that there is a depolarization wave. So sodium entry, depolarization, and then early phase of repolarization is there. D is early phase of repolarization. So A is echo because of the sodium influx. So here this is not the first voltage gated sodium channel, opening a voltage gated sodium channel. Okay, voltage gated sodium channel is there, and there is the influx of sodium. And B is because of potassium efflux. So B is actually potassium efflux here, and here potassium is going out, but calcium, and here potassium efflux is going on, and there is a calcium influx. Calcium will come inside, potassium is going, potassium is still going on, and here also potassium is efflux. Okay, so sodium entry, this is sodium influx is going on, potassium influx. So early phase of repolarization, and this is the plateau phase. Plateau phase is actually because of the balancing of potassium efflux and calcium influx. So positive ion, some positive ion is going outside, and some positive ion in form of calcium is going inside. So that is balancing the and that make actually plateau. So there is no change in the potential. Potential will remain same for some time, and after that calcium entries will closed here at this point of time, and only potassium efflux will be there, and so there is a rapid repolarization. Opening a voltage gated sodium channel is this. Okay, first A is there, opening a voltage gated calcium channel. No, this is not the, this is voltage, opening a voltage gated calcium channel is the C actually. So this is actually A. This is C, transient outward flow of potassium. Yes, this is the B actually, and this is the repolarizing potassium current. So this is the D. So this is the right. So sequences A, C, B, and D. So if you sequence, so sequence will be sorry, A, C, B, and D. So first thing happen, opening a voltage gated sodium channel. Here sodium will enter because of sodium voltage gated sodium channel will open and sodium influx. Second is transient outward flow of potassium. So here is transient outward flow of potassium which leads to early repolarization. Transient outward flow of potassium. So this is a B. Then C, what is the C? C is actually potassium is going out ST and then opening a voltage gated calcium channel. Here opening up voltage gated calcium channel. So voltage gated calcium channel is here. So this will be the C, and next D is the repolarizing potassium current. So D. So A, C, B, and D. So A, C, no, this is not the answer. A, C, this is not going to be answer. A, C, not A, C, B, D. Yes, this is the your right answer. Here, volume of gas expired by normal adult man during a forced expiration, demonstrating the FEV1 and FVC. FEV1. So FEV1 and FVC. FVC is nothing but forced vital capacity, and FEV1 is the forced vital capacity in the first second. So how much amount of air expired in first second, and what is forced vital capacity is after maximum forceful inspiration, after maximum inspiration, how much with maximum effort, how much amount of air you can expire. So first fill your lung with full of air as much as you can, and then expire that full with full force as much as you can. So that expiration is actually this one is graph after full breathe in. So actually if you continue the graph in inspiration, graph will be like this is the inspiration graph, inspiration, and this is the expiration. This is the expression. So graph is complete will be like that. Suppose you are inspiring something. After inspiring, you are full, your lung is full. So after inspiring, your lung will be full, and then you have to expire. So expire, expire, expire. So this graph is not like that, but just for understanding, I am drawing like this. So after full, your lung is full, full volume. So volume is actually an expiring. You are start expiring full, and here you can see the time in seconds in this graph, and here is volume in liters. So liters you can say 1, 2, 3, 4, and 5. So this graph is going to around 5 liter, and seconds 1, 2, 3, 4, 5, 6, 7, 8, 9. So complete force vital. And how much air this person is expired. So total, if you see, this is force vital capacity as much as in. So this is the force vital capacity. So this is actually 5 liter. If it correspond to 5 liter. So force vital capacity is actually 5 liter. 5 liter. You can say here this is the 5 liter, this one. So this graph from here to here, force vital capacity, how much air expired here. So this is around correspond to around 5 liter. Okay, but here time vital capacity FEV1, we have to consider FEV1 also. So divide that by 5. But what is FEV1 in that case? So FEV1 is, suppose FEV1 force vital capacity in first, how much air is expired out of this 5 liter, this 5 liter, how much air is expired in the first second. So first second, this is second, third, fourth, fifth, sixth, seven, eight, nine. So we are looking for the first second. So first second, we can say this is the expression graph, and this is reached around 4 liter. We can easily say this is around 4 liter. So can I write 4 liter? So 4 liter is expired in 1 second, and total expression maximum is 5 liter. So FeV1 is 4 liter divided by Fe force vital capacity is 5 liter. So that will give you answer. So this is actually 4 by 5 into 100 is actually 0.80%. So this is actually 80%. If you calculate, you will get 80%. So it's around 80%, you will get 80%. Okay, here. So answer is this one. In this case, in this person, FEV1 divided by FVC is 80%. So this is a simple calculation. But what is the meaning of that 80%? So what if it will come 70%? What will come if 60%? So that will actually 80% and more. 80% or more than 80% is actually called normal. And if less than 80% or less than 75% in some cases, so that is called obstructive lung disease. Obstructive lung disease, OLD, obstructive lung disease. In that case, expression is very difficult, so person will take a long time. So expression is like, graph will be like this. Suppose 5 liter expression, the graph will be like this. It will take time. Suppose here 80%, to reach 4 liter 80%, it takes around 5 to 6 seconds in that case. Can you see? So this is the, it takes around 5 to 6 seconds for 80% or 4 liter out of 5 liter. Total is 5 liter here. To reach the 5 liter, in that case, it's taking the more and more time. Difficult expression. So that is called obstructive lung disease. And what is restrictive lung disease? RLD, restricted lung disease. So there is vital capacity will decrease. Restriction means lungs cannot expand more, so that is restriction is there. So chest wall cannot expand, or some because of lung, maybe some pathology with lung or fibrosis of lung or any other disease. In that case, lung cannot expand for more, and that case force vital capacity or vital capacity will decrease. But this FEV1 IVC ratio may be normal or increased, may be normal, but force vital capacity total volume will decrease. So this 5 liter will decrease, maybe 4 liter, 3 liter or 2 liter. So this volume will decrease. So this volume will actually decrease. In that case, called restrictive lung disease. So this is the one of the most common investigation to know. So person is suffering from obstructive lung disease or restrictive lung disease. So this is the answer C. Simple calculation, obstructive and restrictive lung disease. So let's move to the next. So here question is that addition of 500 ml of hypertonic saline of ECF, extracellular fluid, means giving injection. Okay, simply saline is infused, so saline will go to the extracellular fluid, or you can say plasma, mix with the plasma and then it will go with the extracellular fluid. Okay, so addition of 500 ml of hypertonic. So here saline is hypertonic to ECF leads to what may be the change, you will see. So first understand this graph. So this is the normal graph. So normal state graph, and this is called Darrow Annett diagrams. So this diagram is known as Darrow Annett diagram. Just keep in mind that this is known as Darrow Annett diagram. So here you can say volume in liters, okay, and this is the osmolarity. So normal osmolarity of the can consider as a 300 for theoretical purpose. 300 is there, otherwise 292 or like 295 like that normal, but 300 is for calculation purpose we use. So 300 you can consider normal. So this is the intracellular fluid and this is the extracellular fluid. As we know, the intracellular fluid is more. So total body water is 60%. So this whole graph is showing 60% of body water. Okay, and this is the intracellular fluid, 2/3 and 1/3. Okay, so this is the intracellular fluid and this is the extracellular fluid. So, and this is a normal state. Normal state means osmolarity is around 300 and fluid is distributed properly. So this is a 2/3 and 1/3 distribution was there, and osmolarity was also same in the both the cases. Okay, but here what if you can infuse the hypertonic saline in that person? So let's see. If you give hypertonic saline, if you give hypertonic saline, first it will go to the extracellular fluid, and tonicity of this fluid will increase and volume will also increase. Tonicity will increase, obviously tonicity will increase, so osmolarity will increase in this fluid. And if osmolarity will increase, so this increased osmolarity will drag the water from here. Is it drag the water from here? So water will come here. From where? From intracellular fluid. So water will intracellular fluid, water will reduce. So this will shrink, volume will shrink. Okay. And what will happen? Osmolarity, because water is dragging you, so osmolarity will decrease or increase. So osmolarity will actually going to increase. So your osmolarity will increase, and fluid volume is also going to increase in the here extracellular fluid, because your extracellular fluid you are giving the water from outside. Suppose saline, hypertonic saline you are giving from outside. Okay, so whatever saline you are giving, that will remain in the extracellular fluid, plus some more water you are dragging from the intracellular fluids from the cell. So volume inside the intracellular fluid will decrease, and volume here extracellular fluid will decrease more than infuser. So if you are infusing 500 ml of hypertonic saline, this will actually increase more amount of fluid, more than 500, because some more amount of fluid you are dragging from the intracellular fluid. And osmolarity obviously increasing here, osmolarity is going to increase here, fluid volume is going to increase here, and osmolarity is also going to increase to reach to the equilibrium with the intracellular or extracellular fluid, equilibrium of osmolarity, and volume of intracellular fluid will decrease. So let's see here which diagram is going to match this. Okay, so here, so this is the diagram actually, hypertonic line. Here we can see, easily see. So if you are infusing here hypertonic line, hypertonic line, so what will happen here? Volume will increase obviously with 500 ml, and the same time osmolarity will also increase. Osmolarity will also increase, and that osmolarity will drag some water from here to here. So volume, water volume will increase here. Yes, so volume will increase here, and osmolarity is also increasing because you are going to give hypertonic line obviously. And here what happened here? So fluid from here, this point to reach this point, means fluid volume will decrease, because fluid is going to the where? Extracellular fluid. From intracellular fluid, fluid is moving to the extracellular. From intracellular to, suppose this is the intracellular fluid, so intracellular fluid, so intracellular fluid and extracellular fluid volume is increasing, and intracellular fluid volume is decreasing here. And as volume is decreasing, osmolarity will increase. So osmolarity is increasing here, you can say easily this, and osmolarity is increasing in the both the condition. So this will be the, you're going to be answer, hypertonic line if you are infusing. So ECF, volume increase, osmolarity also increase more than infusion, because some amount of fluid will come from the intracellular fluid. And what about the intracellular fluid? Volume decrease, osmolarity increase. So osmolarity in the both the cases, osmolarity will increase, in the both the condition, but volume will decrease in the intracellular fluid, and volume will increase in extracellular fluid. It's clear? So now let's see other diagram. What is the other diagram? This is the normal diagram, this is a normal. Okay, and this is what happens, this is the actually normal line. Okay. So this is the normal saline. What happened normal saline? If you infuse normal saline here, what will happen? Extracellular fluid volume will increase, and that osmolarity is actually same for that of, so there is no difference between the osmolarity of intracellular extracellular fluid. So there is no difference. So there will be no exchange of water. No fluid will come from or go from this side to this side, but only volume will remain increasing the extracellular fluid. So here you can say, easily say, the volume is increased but osmolarity is same. So there is no change in the volume in intracellular fluid. So no change in intracellular fluid. ICF, no change, and ECF, extracellular fluid. So this is the ECF. What will happen? Volume increase and osmolarity will remain same. There is no change in the osmolarity. Okay, clear? So let's see one another diagram. This is C diagram. So what is, so let's for C. So what happens here? We are going to give, actually this is the hypotonic. Suppose hypo hypotonic line. In this diagram you are going to give hypotonic line. So what happens hypotonic line if you give, so if you are give, if you will infuse hypotonic line here, so what will happen? Hypotonic line, osmolarity will decrease obviously, fluid volume will increase, hypotonic, and as this is the hypotonic, so osmolarity here is just decreasing, so fluid will move from this side to this side, so fluid volume will increase here also, and because of the fluid volume increasing, so osmolarity will decrease. So osmolarity decrease, fluid volume increase, and here also fluid volume increase and osmolarity decrease. So everything will distributed and reach to the equilibrium, and that is the problem. So that's why we should always careful while infusing the fluid. We should select fluid according to the situation. If you infuse hypertonic, question was the hypertonic line. So hypertonic line, if you infuse, so what will happen? Extracellular fluid, you are going to infuse in extracellular fluid. So extracellular cellular fluid volume is going to increase, and because of that osmolarity, high osmolarity, so extra water will come from intracellular fluid also. So volume of intracellular fluid will decrease and extracellular fluid will increase more than infusion, because some amount of more water will come from the intracellular fluid also. And because of the osmolarity, because of the water is moving from intracellular fluid, so osmolarity in intracellular fluid is also going to increase, and extracellular fluid osmolarity is already high because of the hypotonic line, and volume is also high. So extracellular fluid volume and osmolarity both high, but intracellular fluid your osmolarity is going to increase and volume is going to decrease. In case of normal line, no change, only in the intracellular fluid only normal line. So this is the normal line in the case of, so here only this space, extracellular fluid space is going to increase the volume, because osmolarity is the same, so there will the no exchange of fluid will not go from extracellular fluid to intracellular fluid, or there is no change in the osmolarity, so only volume will increase in the extracellular fluid volume. Okay. And what about C? C is the hypotonic line. If you infuse the hypotonic line, in that condition, what will happen? Because of the hypotonic line, you are going to increase, so volume will increase and osmolarity will decrease. Okay, in the extracellular fluid space, and because of that, osmolarity is more in the intracellular fluid, because you are infusing the hypotonic line, the extracellular fluid. So extracellular fluid osmolarity is going to decrease, and that will actually help water will move from the extracellular fluid to intracellular fluid, so intracellular fluid volume will increase, and because of that intracellular fluid osmolarity will decrease. Okay, so total osmolarity will decrease, extracellular fluid and intracellular fluid both, and volume will increase in both the condition. Okay, so I think I'm clear. So let's move for the next slide. A 45-year-old man inhaled as much as air possible and then expired with maximum effort. Okay, so he, a 45-year male, inhaled as much air is possible and then expired with maximum effort until no more air could be expired. So no more air can be expired. This is actually forced vital capacity or vital capacity. Okay, so this action record this expiratory flow volume curve shown in figure. So this is recorded, and where is recorded? Here. This is the graph recorded this volume. What is the force vital capacity in this milliliter? So in this graph you have to calculate the force vital capacity. What is force vital capacity? So force vital capacity is nothing but inspire as much as air you can and then expire with forcefully as much as you can. So with full inspiration to full expiration. So height of inspiration, go to the height of inspiration, inspire as much as you can, and then expire as much as you can. So if you expire maximum, that is called from maximum inspiration to maximum expiration, that is called forced vital capacity. So here lung volume in liters. So liters is from 0, 1, 2, 3, 4, 5, 6. Okay, and he is reaching to 5 point around 5.5. That is the expression. So how much air he is expiring. So actually this is the inspiration curve. So like that. So he is inspiring. So this is the inspiration curve. Okay, so after maximum inspiration he reached up to this level and then he expired. So that expiration is covered here, and but speed is decreasing. So initially speed was very high, around 400 liter per minute volume. So after that he reached to 300 liter per minute, then 200 liter per minute, then 100 liter per minute, and then finally he expired all the amount of air. So expression was done, and again he will inspire like that. So this is the inspiration curve, and he will again reach to that point. If you want to repeat the test, you just ask subject to inspire again and again and then expire again. So he will expire like this. Okay, so this will graph like this. You will develop a graph. So this is inspiration and this is expression. Okay, no confusion for that. So here force battle capacity. So clearly force battle capacity from this point to this point. Why this point to this point? Because force battle capacity is inhaled as much as air possible. So he inhaled as much as air possible and then expired with maximum effort until no more air could be expired. So he expired maximum until no more air can be expired. It means he left some amount of air. You know clearly that you cannot expire all the air present in our lungs. Some amount of air will remain in our lung, that is called residual volume. So this is 0 to 1. So first 1 liter down is this is called residual volume. So this is not, you cannot expire even after maximum forceful expiration, maximum effort, even that. So that amount is remain. So we'll start from here 1. So 1 liter is minus. So total graph is 1, 2, 3, 4, 5 and 5.5 liter expiration. So expiration expired value is 5.5 liter total volume, and but 5.5 minus 1 is equal to 4.5. 4.5 liter will be answer. So here answer is the 4. So this one is going to be your answer, 4.5 liter, not 5.5 liter. So not from 0, because some amount of air you are not going to expire. This is the residual volume, रह जाता है volume, that is called residual volume. Here that is around 1 liter in this case. So this 1 liter is residual volume. So after that air is expired. So he expired from 5.5 liter. After full inspiration he reached up to, he filled his lung with 5.5 liter of air and expired maximum. So he reached up to 1 liter. So 5.5 minus 5.5 minus 1 is actually 4.5 liter. So that is your vital capacity, force vital capacity. Clear? So let's move to the next question. So just read the diagram and try to answer. Just read the diagram carefully. Here don't get confused about this one. This is a residual volume. This amount of air is still remaining in the lung. So total volume is 5.5 liter, but still 1 liter is still inside the lung. So force vital capacity will be here 4.5 liter. So now let's move to the next question. So here question is compliance curve below. So this is the compliance curve below. A curve signify which of the following disease? A curve. Curve A signify which of the following disease? So curve A is this one. This is the normal curve clearly mentioned here, and this is the A curve. We are looking for the what is the curve A. So answer is the pulmonary fibrosis, emphysema, both A and B. No. Okay, let's first discuss this graph. So what is that? Transpulmonary pressure in centimeter of water. So this is the 0, this is 10, this is 20, this is 30, and this is 40. So transpulmonary pressure, and this is the lung volume in liters. So residual volume, this is the residual volume starting from residual volume. This is not zero actually. So you are starting from residual volume. So some amount of air is still remaining in the lung. So volume zero is here. So suppose this is a 1 or 1.2 liter. So you are starting from that. Okay. So residual volume is here. So I am not going to talk about that residual volume. So suppose this is starting from residual volume because you cannot expire that amount of air. And normally you are expiring like this. Compliance. So when you expire, so change in the pressure, change in the delta V by delta P. So here you can say change in the volume with the change in the pressure. So you are changing the pressure, transpulmonary pressure. So here 10, 20, 30, 40, whatever pressure, and how much volume is changing in the lung. So suppose this is a 10. So make a graph. Okay. So you can easily say here with the 10 pressure of centimeter water 10, here is the volume is 1.5 liter, here volume is around 3 liter, here volume is around 4.5 liter. Okay, it means this lung is not so compliant, this is normal compliance, and this is high compliance. Compliance is increased means you are going to increase some amount of pressure and lung is inflating very less. In this case lung is inflating only 1.5 liter, here is normal, it's around 3 liter. If you are giving some pressure 10 centimeter water, that pressure can inflate or give amount of air that is around 3 liter. Volume change will be 3 liter in that pressure. 10 centimeter water will change the volume 3 liter in this case, and in this condition it's going to change the volume so much, 4.5 or 5 liter, 4.5 liter or more than that. It means this lung is very easily inflatable, and that is more and more compliant easily. So that is seen in the case of emphysema more than normal. So that is seen in more than emphysema. This one A, lung is easily inflatable because of the elastic tissue, loss of elastic tissue in the emphysema. So that lung is very inflatable. Easily you can inflate. So elasticity is decreasing and lung is, if you change the pressure little bit, so lung will inflate so much. So lung is more compliant, but it's not a good condition. So compliant means it's not a good condition, both the condition. So compliance less is also not a good condition, and increased compliance is also not a good condition. This is actually fibrosis. Fibrosis means stretchability is very decreased. Stretchability is very decreased, lung is fibrosis. So in that case, if you are increasing the pressure 10 millimeter of centimeter water, but change in the volume is only around 1.5 liter. So for change around 3 liter, you have to inflate or increase the pressure so much, around 20 centimeter water you have to increase to inflate or increase the change in the volume. For 3 liter you have to inflate twice the normal. Increase your pressure should change twice of the normal. In the normal condition, you will achieve 3 liter volume with the change in 10 centimeter water, 10 centimeter water. But for that, the same volume, you have to increase 20 centimeter water. In the case of pulmonary fibrosis or any other disease, that is a restrictive type of lung disease or any type of disease where the compliance is decreased. Okay, and in case of compliance is increased, in that condition, lung is easily inflatable, or in that case slight change in the pressure will increase the volume so much, and that is also not a good condition. Both the condition is not good. So compliant, decreasing the compliance or increasing the compliance is also not good. So in case of emphysema, because of loss of elastic tissue, so lung is easily inflatable, and in that case lung is easily inflatable. With the slight change in the pressure, volume will change so much. So here answer will be the A, showing the emphysema. Compliance curve below. So clear, answer is the emphysema B here. Okay, so this question is repeatedly asked in the so many exams. So here question is, interstitial fluid volume is best measured using a combination of which of two dyes. So here two dyes, you cannot interstitial fluid is, you cannot calculate with single dye. So for that you have to use two dye. So which two dye? So let's see what are the different compartment. So suppose this is the intracellular fluid or cell. Suppose this is cell, or we can say intracellular fluid, intracellular fluid. Okay, inside the cell, and this is the interstitial fluid, and this is the your blood vessel. Okay. So this is the cell. This is the cell. So I can say intracellular fluid. This is the interstitial fluid, and this is the plasma. And we can easily say interstitial fluid plus plasma is extracellular fluid, and this one is intracellular fluid. This is the intracellular fluid, and this is the extracellular fluid, interstitial fluid and plasma. And whole of these things is called total body water. Total body water. Total body water is around 60% of water body weight. So total body water include plasma, interstitial fluid, and intracellular fluid. So total body water, to detect or to calculate volume in total body water, for that we can use D2O, D2O and T2O, deuterium oxide and tritium oxide. This is the simple answer. So here D2O is there. So we can use D2O or T2O for total body water to calculate total body water. So we can use D2O or T2O. Okay. So if we are going to calculate intracellular fluid, suppose you are going to calculate intracellular fluid, here interstitial fluid. So let's discuss first and then you can able to answer. So if you are going to calculate intracellular fluid volume, so what you can do? Intracellular fluid. So can we intracellular fluid? So you are going to calculate this volume, intracellular fluid. So for that, can we do one thing? Total body water. So this is the total body water, and minus ECF of this volume, minus ECF. Then you will get this much. This is total volume, and this is the extracellular fluid volume. If total body water minus extracellular fluid, you will get intracellular fluid volume. Is it? Yes. So total body water minus extracellular fluid. So total body water, for that you can use this two dye, D2O or T2O. Is it easy? And for ECF you can just use Simon. Okay. So first is sucrose. Sucrose, we can use sucrose. Next you can use inulin, mannitol, and then we can use sodium thiosulfate. So these are the things we can use for the extracellular fluid calculation. Simon, Simon, you can use this to remember. So S for sucrose, I for inulin, M a mannitol, and then sodium thiosulfate. So these are the things you can use for the extracellular fluid, and total body water can D2O and T2O. So you will get intracellular fluid volume easily. But here question is interstitial fluid. So what you can do interstitial fluid? So to calculate interstitial fluid, so this is the interstitial fluid. So for that, can we do extracellular fluid? This is the extracellular fluid minus plasma. So suppose extracellular fluid minus plasma. So this is the total is extracellular fluid minus plasma, then you will get this volume easily, because this is the extracellular fluid, and if you want this volume, so you can subtract or minus this one plasma. So extracellular fluid minus plasma, you will get easily interstitial fluid volume. So you will get this volume. So extracellular fluid, you know what is the thing you can do. So you can use sucrose, you can use mannitol, inulin, you can use mannitol, and you can sodium thiosulfate. So Simon, you can use code word, and S for sucrose, I for inulin, M for mannitol, and N for sodium thiosulfate. So that you can use for extracellular fluid. So what will use for plasma? So you must know the plasma. How will you calculate the plasma volume? So for plasma volume, you can just use two things. One is Evans blue dye, and second is radio level albumin. So albumin, that is radio labeled. So Evans blue and albumin, radio level albumin. So now we can go for the options and then search for the. Here option is inulin and Evans blue dye. Yes. So inulin, here you are going to interstitial fluid calculate. So interstitial fluid means what? Interstitial fluid means extracellular fluid minus plasma. So for extracellular fluid, inulin can we use? Yes, we can use, because here extracellular fluid we can use. Just wait. Okay, for extracellular fluid we can use this one, anyone. So sucrose, either we can use inulin, we can use mannitol, we can use, and sodium thiosulfate we can use. So here we are using inulin here, because this the option is inulin. And for extracellular fluid, for plasma, so plasma what we can use? So what is the option here? So we have two things, albumin or Evans blue dye. So here is the Evans blue dye is there. So I think answer is clearly this one is the answer, is going to be answer, your answer. But let's see the other option, Evans blue dye and D2O. Obviously not, because D2O is used in the total body water. So here you can see total body water, D2O and T2O. So this is not going to be answer. But tritium oxide, obviously this is not going to answer. Inulin, yeah, you can use inulin, but not with that. So here D2O, obviously not mannitol. You can use mannitol here, but not D2O. So this is not going to be answer. So this is not going to be answer. This is also not going to be answer. Answer will be A. A is inulin and Evans blue dye. Inulin from ECF calculation and Evans blue dye for plasma calculation. So ECF minus plasma, you will get the interstitial fluid volume. So very simple. Just keep in mind this chart on and drawing and what I have written here. So that much is enough for to answer for all the question related to this, any question. So it may be total body water, so you can do like that simply. Intracellular fluid, you can total body water minus extracellular fluid. Interstitial fluid, ECF minus plasma. So option may be changed in the in other option may change, but you can able to answer if you remember this thing. Okay, so let's move to the next. A 40-year-old woman has a resting heart rate of 70 beats per minute. Okay, so a 40-year-old woman has a resting heart rate 70 beats per minute at arterial pressure 130 by 85 millimeter of mercury. So this is a normal blood pressure, and body temperature is also normal. When does the first heart sound occur? In the ventricular pressure volume relationship. So this is the ventricular left volume pressure volume curve. This here question is first heart sound. So first heart sound, where, at which point first heart sound? For that we just let's try to understand this graph first, and then we'll go to the answer. Okay, so here left ventricular volume. Okay, so volume in ml, left ventricular volume. So here is the 0 and here is the 50. So volume is started from 50, and here is the 100, and here is the 150. So maximum reach to 150, 200 not reach. So here is the volume 0, 50, 100 and 150. Okay. And what is the pressure? Pressure millimeter of Hg. Okay. So this, at this point you can say volume is around 50 ml in the left ventricle. So this is talking about the left ventricle only. Volume is 50 ml and pressure is almost zero, slight more than zero. So it's almost zero. Okay. And volume is actually end systolic volume, end systolic volume, because this is the, and then diastole will start. So diastole will start, and diastole means filling of the ventricle. Volume is increasing. So it was 50 ml, now it's 100 ml, and now it's 150 ml. So volume is increasing in left ventricle at this point of time, but pressure is not increasing so much. Pressure is still same, not even 50, so not even 25. It's less than, very less. Pressure is very, very less, but volume is increasing. And after that suddenly volume is no change in the volume, but pressure is actually increasing. Can you say the increasing the pressure here? So this is the, so pressure increase but volume same. Here in the B, volume is 150 ml and pressure is increasing. So pressure is going from here to, suppose here, a straight line. So this is 100, it may be 80. Wait. So this is 85, because here mention is 85 and it is 130. So this is suppose 130. Okay, and this is 85. So highest point is 130 and it's 80. So this point is called volume, no change in the volume and increasing the pressure, that is called isovolumetric contraction. So when ventricle start contracting, pressure will increase, but because pressure in the aorta is still 80 millimeter, 85 millimeter mercury. Diastolic pressure is 85, so it means aorta pressure is 85 millimeter of mercury. So you have to reach up to that level and exceed that pressure, then only this valve between ventricle and aorta will open, and then blood from the from ventricle to the aorta will go, and then volume will start decreasing. So this is the decreasing volume. Volume is start decreasing. So this is a 150 ml here, and then volume is going to decrease there. So it's around 100 ml here at this point of time. Volume is decreased. So this is the first rapid ejection phase. So actually, when isovolumetric contraction is start, it means ventricular pressure will going to increase. So when start increasing pressure of ventricle, that will actually close the atrioventricular valve or tricuspid valve. We can say valve will close, and that actually produce sound of first heart sound. First heart sound. First heart sound is produced because of the closure of atrioventricular valve, and valve is closed when ventricle will start contracting. That is called isovolumetric contraction. No change in the volume, but change in the pressure. Atrium pressure is not so much high, and when ventricle will start contracting, then pressure of ventricle will increase more than that of atrium, and in that case atrioventricular valve will close, and that will actually produce first heart sound, and there will be no change in the volume, and volume will remain same. So that, as per the question, answer will be B. Okay, at point B, this is the answer. But let's discuss the whole the graph, then it will be better for you. So after that contraction, ventricular pressure will continue rising. Suppose it was reach to 50, then 80, 85. And when it will exceed the aortic pressure, then aortic valve will open and blood will rush from the ventricular to the aorta, and then volume will start decreasing. Okay, that is called a rapid ejection phase and then slow ejection phase. And then finally all the volume, stroke volume is around 70 ml will come out from the ventricle. Not all the blood will come out from the ventricle, but some amount of blood will remain in the end systole, means systole. After the systole, some amount of blood will remain in the ventricle. So that will remain in the, so this is the 50 ml. So 50 ml will remain and 70 ml stroke volume will ejected from the ventricle to the aorta. And after that, isovolumetric relaxation. So this is isovolumetric contraction, and this period is actually isovolumetric relaxation. So there is no change. So of volume will reach to the minimum. All the volume from ventricle to aorta is pumped. So as a stroke volume, and after that, ventricle will start relaxing. So this is the relaxation, isovolumetric relaxation phase. So volume, when ventricle will start relaxing, then backflow from aorta is try to come, blood will try to come from aorta to the ventricle, and that point of time there will be appearance of the second heart sound because of the closure of the aortic and ventricular valve. So that second heart sound will be appeared, second heart sound will appear at this point of time. So just keep remember the D point is actually, this point is actually second heart sound. After that there will be no change in the volume because ventricle is going to relax, pressure will decrease, but volume will be the same. And once volume will reach to the around zero, less than that of aorta, left atrium pressure, ventricular pressure will be less than that of atrial pressure, then only atrioventricular valve will open and blood will come from the atria to the ventricle, and then volume will start increasing from 50 ml to 100 ml. Because atrial pressure is very less at this point of time, blood will not increase because this is very high pressure, around 100, 85, 50. So it's more than that of atrial pressure. Atria is still not open. So when it's reached less than that of atrial pressure, and then only the atrioventricular valve will open and blood from atria to the ventricle come because of the gravity, and in that case volume will start increasing. And when volume will reach to this level at end diastolic volume, and then again ventricle will start contracting, and that is called isovolumetric contraction. Again pressure will increase more than that of atria, and because of that there will be closure of atrioventricular valve, and that will produce first heart sound. So first heart sound is produced here because of the closure of atrioventricular valve, and that is called beginning of isovolumetric contraction. And after that finally isovolumetric relaxation will produce second heart sound, a start of the isovolumetric relaxation. So I think it's clear in this graph, the whole graph is clear. Answer here is actually at point B, first heart sound will produce. If question will be like that, what is the second point D? It's second heart sound produce at point D. A person come to the hospital. After RTI. So road traffic accident was there, and he had severe muscle injury. So because of this muscle injury, serum potassium level was 5.5 milliequivalent, means increase. So this is not normal, but this is the actually increased serum potassium level. Now what will happen to RMP? So what about resting membrane potential? So here question is the resting membrane potential. So normally inside the cell potassium is very much high, and outside is very much low, around 4.5 like that. But here potassium is increased. Question is that here potassium level is increased because of the road traffic accident and because of the muscle injury. So because of leakage of the potassium. Potassium will come out from the injured muscle, and that is actually increasing the potassium level outside. So what would happen to resting membrane potential? Question is that. So normally what happens, membrane potential, potassium is inside more. So whenever the potassium channel open, so potassium will leak out from inside to outside, and potassium is the positive ion. So suppose minus 90 millivolt. So if potassium will leak out, so it will make minus 80 or minus 70, minus 60 like that. Okay. But this is because of gradient. So gradient is very much high. So here is suppose 140 or here is 4. So gradient is very much high, and in that case this will move out easily. And well, this potassium channel will open, and then some amount of potassium will leak from inside to outside. But as here potassium level is increased, not normal, it's increased. So here we can say more and more potassium is already there outside in plasma or interstitial fluid. So serum level of potassium is increased. So what will happen in that condition? Potassium gradient from inside to outside is decreased. Actually gradient is actually decreased here, not so much, but still that will affect potassium leaking out. So potassium will not easily leave the cell in that condition. It's very difficult for potassium because gradient is decreasing than normal. So normal gradient was there. So suppose it's 4, in that case potassium will leak from inside to outside. But here is not 4, here is it's 5.5, means it's increased. So gradient is going to decrease. In that case this movement of potassium from inside to outside is actually going to decrease. In that condition potassium inside level will actually increase. Inside the cell potassium level will increase, and that will actually, what will happen, positivity. So minus 90 is there, and positive charge of potassium is not leaking out, so that potassium level will increase. So positive ion as a potassium will increase. So this resting membrane potential will towards the positive. So minus 90 was there, suppose this is minus 80 because of the more and more potassium accumulation, because potassium is not going to leak out from the cell or not easily leave the cell, because outside concentration gradient is decreasing, or outside the cell concentration potassium is high. Because of that concentration gradient from the inside and outside is decreased, so less potassium will leave the cell. Gradient is less, so less potassium will leave the cell. It means more and more potassium will remain inside the cell, and that will actually increase the cell towards the positive direction. So negative will decrease and positivity will increase. So suppose it was minus 90 to minus 80, minus 70, and it will reach to the threshold level value, and that will actually generate more and more action potential. So action potential will generate more and more. So action potential will generate more and more. Okay, so repeated action potential may lead to arrhythmia, cardiac arrhythmia. So this is the danger situation, but here we can easily see that it's going to be towards positive, because positive ion concentration is going to increase inside the cell. So let's see the answers. No change, obviously this is not going to be answer, because there will be change. And change, what change will be there? So positivity. So more positive, yes, more positive. So this is going to be answer, because it was minus 90, so minus 80. Suppose it's going to minus 80, so this is actually towards positive side, means less negative, or you can say more positive. So this is going to be your answer here. More negative, no, not more negative. First positive then negative, no, this is not going to be answer. So answer will be more positive here. Okay, so thank you so much for today, and see you soon, and all the best for your examination. Thank you.